In this episode, I'm taking you through what a health coach does and what they don't do. This is a very personal, passionate plea, a rally cry from my own personal perspective as a practicing health coach, but also a health coach educator and a health coaching industry leader who really believes and is passionate about the scope of health coaching. Our scope is incredible. Our actual legal professional scope of practice is amazing. We have the ability to make massive, impactful, important changes in people's lives without stepping in to somebody else's role. And by that, I mean, we're not putting on our imaginary lab coat. We're not playing doctor. We don't have to. Clients don't need more of that. They need help making minute and impactful behavior changes in the context of their lived experience. And that's what a health coach gets to do. So please enjoy my riff on what health coaches can and should do.
Hi, I'm Erin Power. I'm a health coach, a health coaching educator and mentor, and your host of Health Coach Radio. This podcast delves into the art, science, and business of health coaching. Whether you're aspiring to land a coaching dream job or to embark on your own entrepreneurial adventure, we cover it all. Our mission is to help you grow your career, elevate your income, change the lives of the clients who need your help, and leave a lasting mark in this rapidly growing field. It's time for health coaches to make an impact. It's time for Health Coach Radio.
So today we're going to talk about something that I think every health coach needs to hear, whether you're just starting out or you've been at it for a while, or you're already working with clients, and you may be occasionally wondering, what is my job? What is the job of a health coach? What does a health coach do? It's an important question to ask and answer, actually. So I'm glad we're doing this. I'm glad we're having this conversation because the visibility of health coaching is growing, which is amazing. But with that comes a lot of confusion, a lot of gray area. The industry sort of launched into being, and now it's trying to kind of clean up the edges, you know. Clients don't always understand what we do, but honestly, sometimes coaches don't either, and maybe the world doesn't. But this is not your fault. It's still a young industry, and the lines between coach and consultant and trainer and influencer can get very blurry. So here's the thing. The clearer you are about your scope and what you do, the more trust your clients will have in you. This confidence comes through a competent knowing, an unconscious competence of what you absolutely do. And that competence in knowing will give you confidence, will give you the air of confidence you need to be successful in this industry. Yeah, you'll feel confident in yourself as well, which is a great way to proceed with anything in life. So clarity is an absolute gift for you and for your clients and for the industry writ large. So in this episode, I'm going to walk you through exactly what a health coach does and what a health coach does not do. We'll bust a few myths. We'll clear up some of the confusion between maybe some industries that seem to really overlap. And most importantly, remind you why health coaching is a pure calling and how when you do it right, it's incredibly powerful. So let's start by getting clear on what a health coach does not do. Because this is where most of the confusion and frankly the risk tends to live. So first of all, you do not diagnose, treat, or prescribe. That is outside of your scope. Even if you think you know what's going on with someone, even if they want to tell you what their blood test said, even if they want you to tell them what supplement to take for their thyroid, it's not your role. That's for the licensed practitioner. I feel really, really passionately about this. And I'm sticking this flag in the ground as deep as it will go because I'm not excited about some things I'm seeing in the health coaching space and the health coaching education space, honestly, where health coaches are being encouraged to run a bunch of lab tests on their clients. That is not in our scope of practice. First of all, absolutely not. Secondly, this is a personal perspective, but is that why we got into health coaching, was to diagnose people with more pathologies than they already think they have? Like, do humans need more diagnoses or do they need help executing the basics? Because I'm telling you, I think it's the latter. Yeah. Is your weighted vest and your anti-cortisol supplement going to help you with your menopause weight gain if you're not sleeping, moving, stressing, living, eating, breathing appropriately? No, it's not. So we have so much room to act with people. We have so much room to play inside our scope. We don't have to lean on these out of scope practices. Second, you are not a replacement for a doctor, a dietitian, a therapist. Now, you might be one of those things. I know for sure we have doctors who become health coaches. We have nurses and nurse practitioners who become health coaches. We have tons of therapists who become health coaches. Dietitians who work with health coaches, we see that a lot as well. Now, if you have a broader scope of practice because you have an additional credential, that's amazing. Your scope of practice as a licensed practitioner broadens your ability to do things, and you can use your health coaching skills in the relationships with your patients and clients. That's amazing. If you're just a health coach, like I am, I'm just a health coach, then I have a very clear scope of practice. I'm not interpreting lab results. I'm not prescribing supplements. I'm not creating meal plans. This is interesting because actually I do have a nutritionist credential, and that enables me to create meal plans. But I absolutely hate doing it. Just parenthetically, personal anecdote. I don't want to make a meal plan. Meal plans don't help people change. And I'm a health coach. I want to help people make lifelong change, and a meal plan ain't it. But it's actually out of scope of practice to make a meal plan, unless you're a dietitian or maybe a nutritionist. It's a big one. Coaches get tripped up here a lot. Clients ask for a plan. Oh, I've had clients say to me, I just want someone to tell me exactly what to do. But that doesn't work. They think they want a plan. They think they want rules, guardrails. They want the magic checklist, and you might feel tempted to give it to them. You might feel an obligation because you want to help. Oh, this client wants a meal plan. This client wants a food list. This client wants a supplement regime. But handing over these rigid plans isn't coaching. It's dictating. It's teaching and telling. I always teach my coaching students, like, we don't teach and tell. That's not our role. We're coaches. I just think it undermines the potential power of what we can do to just be teaching and telling and talking at people. That's not our role. I want you to be in a partnership with your client and guiding them along the execution of the changes they need to make. I actually want to just pause for a minute because the line between health coach and personal trainer is one that I think is really interesting. And it can get fuzzy because some health coaches are personal trainers and some personal trainers are health coaches, but the two roles are not really interchangeable. They can coexist beautifully. It's important to know which one you're stepping into when you work with a client and really kind of like putting on your various different hats. So let's break it down. A personal trainer is certified to create and guide a client through physical exercise, training protocols, movement assessments, programming, cueing, safety, progression. So the personal trainer's job is to focus on physical fitness, building strength, improving mobility, increasing endurance, reducing risk injury. Beautiful, beautiful, necessary. Thank goodness for personal trainers. They might typically work in a gym or in a studio or might do private sessions, or maybe you're an online personal trainer. I absolutely love this for the personal training industry, this whole move to online and online group coaching and things like that. Beautiful. But you're literally programming and walking people through exercise. A health coach focuses on behavior change and lifestyle habits. So our job isn't to program the squats and lunges and deadlifts. The personal trainer can do that, okay? Our job is to help someone figure out why they haven't been exercising, how to get back into the rhythm, how to fit it into their life. Oh, the trainer gave you this protocol. Let's put it into your world. What needs to shift in your life so that the movement becomes a sustainable practice, not just an aspirational one that you're not doing? A coach doesn't say, here's your workout. A coach says, what would make movement feel easier or more consistent for you right now? What would make it feel easier for you to execute the workout plan your personal trainer gave you? Now, if you're both, and a lot of people are, that's amazing. So think about that. You can create the program in your personal trainer role, and in your health coach role, you can work with the client on executing it. So just be clear on that in your own mind. I think your clients won't know when you switch hats. They're not going to perceive that. But I think it's important for you to be clear in your own mind. Because health coaching is not really about getting the reps and sets in. It's about the habits, the identity shift, the skill development. By that, I mean the developing the skill of being consistent with the actions necessary to improve health. The truth is, many personal trainers already do a lot of coaching without realizing it. They're listening, they're encouraging, they're helping clients move through resistance. That becomes baked in the cake of the personal training relationship. And I say this as somebody who has a personal trainer. I talk about everything with my personal trainer. The things I share with my personal trainer would blow your mind. I'm sure you know. Like, there's no boundary there, unfortunately. I feel sorry for my trainer sometimes, the things I unload on them. You get it if you're a personal trainer. You are that sounding board. But really, health coaching is what's going to take what a client says and put it into action for them. So if you're a trainer, shore up your health coaching skills. And now you've got a system that really helps folks change. If you're a health coach and you're not a trainer, you don't have to pretend to be one. You don't have to pretend. I am a trainer. I'm a certified personal trainer, but I don't really execute in that way. I don't want to build fitness programs, so I don't. My clients need to lift weights. They need to get stronger. But I actually outsource that to personal trainers. Like, I've got a great trainer I can recommend, or let's find a trainer in your city if you can afford it. Or you can't afford it, let's go find an online app, a really good one that's going to guide you. There's more than enough value in coaching alone if you do it well. You don't have to feel like you need to do everything. You don't need to do lab tests. You don't need to program fitness if you don't want to. And personal trainers are amazing at programming exercise, but may or may not be masterful health coaches. I think there's a really beautiful synergy there. I'd love to see that coming together more. That's something that I feel really passionately about. At our school, Primal Health Coach Institute, we created the Primal Fitness Coach certification. And the thinking behind that was, I want fitness trained professionals who also know how to coach. I want to blend it into one. And we created this certification, and we're liking where we're going. So the idea is, if you hang with me here, in your personal trainer role, you're programming the workouts and you're plugging them into the client's schedule, and you're having a coaching call with them as well. So workout, coaching call, something like that. On the coaching call, it's not how many sets and reps did you do? It's like, what's your intention for the next week? How many workouts would you like to get in? Why is this important to you? How are we going to fit this into your life? What barriers, if any, might get in your way? I love that. I love that idea. Let's tackle another adjacent area of confusion: health coaching versus nutrition coaching. This one can be tricky because the titles sound interchangeable, and depending on someone's training, like what school they went to, they might actually mean the same thing. But there is one distinction that matters, especially when it comes to scope of practice and the kinds of results you're supporting. So a health coach focuses on the whole person, not just what they eat. We're trained to support behavior change across multiple domains. So yes, nutrition, but also sleep, stress, mindset, movement, routines, emotional wellness, the whole big picture of the human. So we help people build sustainable lifestyle shifts. We help them develop skills to execute their wellness behaviors in the context of their lived experience. A nutrition coach, depending on their credentialing, often focuses more narrowly on food, like macros or portions or calories, or they might do meal plans, even though I do think that's out of scope for a nutrition coach. It's more in the realm of a dietitian or a nutritionist. I'm extremely staunch about scope of practice, if you haven't noticed.
If there's one thing I've learned in my years as a health professional, it's that changing lives is much easier when you're doing it alongside a team of experts. Physicians, nurse practitioners, and other care providers have learned this too, which is why they're looking for health coaches just like you to join their medical patient care team. Primal Health Coach Institute's Health Coaching in Medical Practices Specialist certification prepares you for that. You'll learn how to work alongside a clinician and advise and motivate patients to change unhealthy lifestyle habits and manage chronic conditions. By the time your studies are complete, you'll be ready to secure a position at a practice that fits best with your coaching style, and you'll have the tools you need to plan programs, accept referrals, and coach patients. If you're a health coach with a passion for helping patients get the life-changing information, encouragement, and accountability they need to make sustainable changes in their health, visit primalhealthcoach.com to learn more about the Health Coaching in Medical Practices Specialist certification.
But a nutrition coach may provide guidance on how to structure meals and what and when to eat, how to hit your macros, how to reduce sugar, how to reduce calories. In some cases, especially in gyms or fitness settings, a nutrition coach is offering very general guidance on eating in service of body composition goals. So quite often the nutrition coach is working in the space of building muscle, losing fat. They're not usually working in the realm of like, I eat when I'm sad, or I binged on chips and guac yesterday and I'm feeling miserable about myself. Like, they're not working a lot into the weeds of folks' relationships with food and their greater health outcomes quite often. A nutrition coach is not a registered dietitian, so unless you have a license or credential that allows you to practice medical nutrition therapy, again, a nutrition coach is not diagnosing conditions or treating symptoms through food or giving clinical level dietary advice like meal plans. I mean, honestly. As a health coach, you can talk about food. I mean, of course you can. And you probably will. A lot of health coaches have an expertise in food stuff. And it's one of the biggest pain points clients have, and it's one of the greatest dial movers for health. But you do it through the lens of coaching. That means you ask questions, help them identify what's worked and what hasn't worked, and support your client in discovering how to eat in a way that feels nourishing, sustainable, and is aligned with their goals. So you may have an expertise in something, right? Maybe you support women who are postpartum, or maybe you work with men who are trying to get rid of their dad bod, a little weight loss, right? Maybe you're like a weight loss health coach. And so you have an understanding of nutrition and how to get people to support these aspects of health they want to change. And you just gently guide them to make meaningful, small, impactful changes to their nutrition in their life. So you're not saying, here's what to eat. You're saying, what's getting in the way of eating in a way that supports your goal? So, can you be a nutrition coach and a health coach? Yes. Yes. You can be a nutrition coach and a health coach. You can be a personal trainer and a health coach. You can be a nutrition coach, personal trainer, health coach. You can be all of these things. The key is knowing which hat you're wearing and then just staying in scope and staying in your lane when you're wearing it. And just to finish this thought, I really do think the health coaching skill, the health coaching credential, elevates the nutrition coach. It elevates the personal trainer. It really does. Health coaching, to me, obviously, very biased perspective, is the game-changing skill set that I'd love to see all trainers and nutrition coaches lean into. So to revisit what a health coach does not do, here's just a quick list. They do not diagnose, treat, or prescribe. We are not playing doctor. We are not replacing licensed professionals. We can work alongside dietitians, doctors, therapists, but not in place of them. We don't do meal plans or macros unless we have an additional credential. Even then, it's more powerful to coach someone in discovering how to eat in their life than giving them a plan to eat, personal preference. And we don't act as a personal trainer or therapist or life coach unless you also happen to be one of those things. Now let's talk about what a health coach actually does. This is the fun part because health coaching is magical. And I actually just want to start with a quick story. I had a health coaching student who was chatting with me about a client outcome she had. And she's been working with this client on her health. And the client is, I want to say the client's type 2 diabetic, trying to, be supported through some type 2 diabetes stuff in the context of a medical setting, and the health coach works in this medical setting. The health coach helps the client execute the plan that the dietitian made. So the dietitian is actually trying to resolve this person's type 2 diabetes, and the health coach's job is to help the client execute the plan. Get it? The coach had a conversation with the client, and the outcome of the coaching session was that the client was going to write 5 thank you cards this week. And these 5 thank you cards are going to help this client resolve her type 2 diabetes. Can I explain to you how? This is great. This is amazing. So the client has these nutrition and lifestyle changes they need to make to resolve their type 2 diabetes. But she was struggling to execute them. She was just having such a hard time getting it done. Like, I don't know what my problem is. I just feel so overwhelmed. So the coach said, well, take me through what's feeling overwhelming to you. Well, I've got this diet thing. I'm feeling unwell, my family, my life, finances. She's like, and then I had a baby shower and I have to write the thank you cards. And it's just this weighing on me that I haven't written the thank you cards for this baby shower. And I'm losing sleep over it. It's just really putting me into a tailspin. So the coach and the client co-created a goal to write 5 of the 50 thank you cards she had to write so she could start to feel less overwhelmed, so she could make the dietary changes that the dietitian needs her to make, so she can resolve her type 2 diabetes. Ladies and gentlemen, that's health coaching. You might get on the call and you might know a lot about everything health related because you're a health zealot. We all are. But you might simply help your client to write 5 thank you cards so they can get out of their own way and resolve their health issues. This is what I'm talking about. I love this for us. Do you see how we don't need to run blood tests on people? A doctor can do that, and the doctor will do that. And then there will be some kind of prescribed change that the patient client needs to make. And then they have to make the change. And that's where we come in. How can I help you make this change feel easy? Because change is hard. How can we make it feel easy? The thank you card anecdote is a beautiful example of this. Clearing that little bit of overwhelm out of the client's brain is going to make it feel easy for her to have her dietitian provided meal plan working in her favor. So she has a hope in heck of resolving her type 2 diabetes. Boom. So what do health coaches do? They help people bridge the gap between knowing and doing. Most people already know what they should be doing. And I'll tell you what, I hear that literally verbatim on the call when I'm doing a discovery call with a prospective client. I know what I should be doing. I'm just not doing it. Ding, ding, ding. That's where we come in. We can help people do stuff. We help people do stuff. You might have heard behavior change agent. I've heard that one so many times. It's just a mouthful for me. I'm the person that helps you execute when it feels hard. I help it feel easy so you can change. We listen deeply and hold non-judgmental space. Now, this is the power of active listening. This is the power of motivational interviewing. The client-led coaching conversation. If these phrases that I'm saying mean nothing to you, it's time to get you into a health coaching course because you need to know these things. You need to develop the skills of active listening, motivational interviewing, and client-led coaching conversation. It is all about the client taking a leadership role in the conversation. Did that just blow your mind? That your client is leading the relationship, not you? Yeah. I think about it and I articulate this when I'm teaching health coaching students. It's a co-leadership. We are partner leaders. We are lateral to each other. I'm not the boss of the client. They're probably a little bit more the boss, quite honestly, because they have to go out and execute this in their life. I don't get to tell them what to do. We have to co-create a plan that's going to work for them. And the only way you're going to co-create the plan is if you're listening, not talking, teaching, telling, listening. And when you do this listening, you're going to hear a lot. You're going to hear a lot about the inner workings of the client's mind and feelings and family and relationships. You need to learn how to hold non-judgmental space that is empathetic at the same time. This is absolutely a skill. The skill, the art, the science of health coaching is a beautiful art and science. And when it clicks, it is a thing of beauty. To hear a health coach hold empathetic, non-judgmental space for a human trying to improve their health and life in the context of their richly diverse lived experience, it is a thing of beauty. We're so lucky we get to do this. What else do? We support behavior change through accountability, clarity, and mindset shifts. Accountability is interesting because ultimately you want your client to learn how to be self-accountable, self-determined, self-efficacious. More coachy terms that I just threw at you. But being accountable to you, I think it works in the micro, not in the macro. So yes, you're going to show up for the weekly coaching call with me, and we're going to talk about what went well and where you struggled and what the intention and the plan is. We're going to co-create a goal for next week. And yes, you are accountable to show up to this session so we can have this conversation. But then when we're off the phone and you're out there in your life executing, You're no longer accountable to me. You're accountable to yourself in all moments. That's a mindset shift because clients think they need us as their accountability partner, but they need themselves as the accountability partner. We can coach them and coax them to that. And we actually must. What else do health coaches do? We create a safe container for experimentation, failure, and learning. So think about every little goal you and your client co-create is basically a little micro experiment they're going to run out and do. Let's go run this experiment and you're going to report back and we're going to see the data of the experiment. We're going to collect the data. So the data will be, this went well, this did not go well. It's almost always like, here's where this shone and here's where this sucked. And that failure is such a nugget of growth and learning. Cool. Why did that piece not work? What about that didn't work for you? What can we make a micro adjustment on and go out and do again next week so that you do have success here? Like the client has to fail and learn to fail better and use failure to fail forward, right? Failing forward. We've heard this phrase before, but like the ability to grow from failure is immense, but people don't like the way it feels. Your clients don't like the feeling of failure. Many people have failed at health attempts dozens and hundreds of times before, and they might say to themselves, I always fail. They might be saying mean things about themselves in terms of being a self-saboteur, always giving up, always failing. I'm not cut out for this. We have to help them fail better because that's where they'll learn. And these little experiments, just keeping it pretty low stakes. Hey, client, next week you're going to go do this one little experiment and then report back and tell me how it went, and we'll take it from there. We're just marching the client down this continuum from experiment to experiment, clocking the successes, clocking the failures, and making adjustments and moving ahead. It's so beautifully deliberate and also so beautifully nimble because the client simply must go out on their own and try to execute. They have to figure out how to execute. Then they get to come back and say, it went okay, but it could have gone better. And we'll say, great, let's make it 10% better. Health coaches help clients uncover the real obstacles holding them back from achieving their desired health outcomes. And the real obstacles are not usually things like genetics or menopause. It's usually their beliefs, their habits, their routines, and their environments. Beliefs, habits, routines, and environments are in the purview of the health coach. What do you believe? Why do you believe that? What are your habits? What can we change habit-wise? Tell me about your routine. Where can we fit this in? Environmentally, what's going on? Who lives with you? What do they like to do? Who works with you? What's that environment like? What about your social connections? Oh my gosh, all of these factors are so powerful for health improvement, and they are 100% in scope of practice for us health coaches. How lucky are we? Health coaches also bring structure and consistency to the client, but not so much rules and restrictions. And that's because rules and restrictions and this really kind of extreme discipline culture that's kind of common in diet and fitness parlance has been typically a barrier for most regular, normal humans. We're not Jocko Willink over here getting up at 4:30 in the morning for our workout every day. Most of us aren't. Most of us are just regular humans trying to live a regular human life. We do need some structure, parameters to follow, consistent action, but we don't thrive. Regular humans don't thrive with rules and restriction. And that's at like a amygdala level in the brain. Like we just push back on that. And if we push back on rules and restriction, push back for years and years and decades, we don't get healthier. No one's getting healthier by failing out of rules and restrictions. So we want to soften that by offering structure and consistency. And finally, what a health coach does is they coach the whole person. So it's not just food and exercise. It is stress, sleep, relationships, purpose, pleasure, environments, feelings, everything. We have an amazing opportunity to do what we do. We don't need to step outside our scope. Our scope is beautiful and rich and impactful and powerful. And the change that you can help people make in their lives, real change that lasts inside their individual life, is inspiring and powerful. And you should be very proud that you get to do it. And we are so needed right now because the healthcare system is overburdened and reactive. Wellness culture is overwhelming and confusing, and coaches fill the gap with consistent support, personalized human connection, and behavior change in real time. You don't need to be a guru, you need to be a guide. Be proud of the non-expert role. That's where the magic is, the partner leader with the client. You have expertise, but so do they. Stay in scope, stay curious, stay in partnership. You're not here to fix anyone. You're here to walk with them while they do the fixing themselves.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.